Carpal tunnel syndrome is numbness and tingling involving the thumb, index, and middle finger. It can also lead to swelling in the hand and sometimes pain that starts in the hand and radiates up into the shoulder or even in the neck.
At first I didn't realize that I had carpal tunnel syndrome, but I started waking up at night with numb, tingling fingers, and I just assumed that I had fallen asleep on my hand the wrong way.
Carpal tunnel syndrome caused me to have numbness and tingling in my fingers. It caused me pain that would wake me at night, and it was making me drop things and not have the proper sensation in my hands.
I chose Dr. Helgemo because I know of his reputation. I have friends and coworkers that have had surgery done by Dr. Helgemo, and they're very, very pleased with the results.
I knew that Dr. Helgemo was well respected in the community. I had heard his name from other doctors, and he is a hand specialist, so I chose him for my treatment.
Carpal tunnel syndrome is diagnosed by taking a history from the patient that involves them having symptoms of numbness and tingling, usually worse at nighttime, and then by following this up with a physical examination and sometimes additional testing, most commonly of which is nerve conduction testing.
I came into the office for a nerve test. The results of that test showed that I had severe carpal tunnel that would require surgery.
He didn't just take my word for it, he actually proved it by doing the stimulation test that I did in fact have carpal tunnel syndrome.
The traditional treatment for carpal tunnel syndrome is open carpal tunnel release. This is a surgical procedure that requires an incision of sometimes 3 to 4 inches in the palm of the hand. It is then sutured with several sutures, and usually a fairly bulky bandage is applied afterwards. With endoscopic carpal tunnel release, a small incision is made in one of the wrist creases, roughly 3/8 of an inch in length. The entire procedure takes about 5 minutes as an endoscope is placed within the carpal canal and the ligament is released. The wound is then closed without sutures.
It only took a very little while to do, and I absolutely had no pain when I woke up.
I woke up in recovery. I had no pain with it, and I went home as soon as they felt I was ready to leave. It's a very easy procedure.
In many cases, you can return to work the next day.
The little incision is so small, and it's so uncomplicated and so easily done. It's the only way to have it done as far as I'm concerned.
With the endoscopic, I had virtually no pain at all. I did not require pain medication after the surgery. I wore a brace for 1 week, weaned myself off the brace the second week, and that was it.
I had to wear a splint on my hand for a couple of weeks. As long as I kept that splint on and didn't use the hand in some way that I wasn't supposed to, I had absolutely no discomfort. I would recommend Dr. Stephen Helgemo to anyone for their carpal tunnel syndrome. My experience with my surgery and the results that I got afterwards are excellent. I achieved everything I hoped for. I'm pain-free, I have no numbness and tingling, my hand is normal.
You can't even see your incision, Marianne.
The endoscopic method is minimally invasive. It's almost impossible to see the incision, and the recovery time is much quicker. I would definitely recommend this procedure to all my family and friends.
Once recognized, carpal tunnel syndrome should be treated to the point where the symptoms are either infrequent or non-existent. If the symptoms continue to persist, in many cases this leads to permanent nerve damage, permanent loss of sensation, permanent weakness in the hand, and even with successful treatment down the line, these symptoms are often irreversible. If you're considering having carpal tunnel surgery, make certain that your surgeon has the training and experience to ensure you have the best possible outcome.